All right. Hello, everybody. Thank you for joining us this afternoon. We are going to be going through this presentation that outlines our benefits that will be changing for 2024. I'm Sarah Street. I'm the Human Resources Director, and this is Ani Lefebvre. She's our benefits manager. And Jonathan Delagrave, the county executive, really wanted to be here today, but unfortunately he had some conflicting priorities and he's not able to attend. But he has been attending all of the in-person meetings that we've been having around the county, and just wanted you all to know that we don't take these decisions lightly. We have been working with our healthcare insurance professionals and experts and reaching out to other counties and municipalities to make sure that we're making the best decisions for our Racine County employees. So before I get started, just want to let you know that the changes are in 4 main areas. So we're making some insurance premium changes. We are also making some changes to our prescription benefits. We are making a change to the way that employees access the emergency room, and we are adding an optional high deductible plan. So during this presentation, we're going to go through each one of those areas, explain why we're making some changes, and a reminder for some of the current benefits that we have and offer all of our employees. So first up, why are changes needed? So during the last few years, there's been inflation everywhere. We've all experienced it. And healthcare has kind of lagged behind some of those changes, but it has been increasing. So over the last 5 years, our health insurance costs have increased 19%. And as we've reached out to experts, we've learned that Racine County's claims are over 26% above the norm. Our prescription costs are also extremely high. Our prescription costs are 776% above the norm, and the cost that employees are contributing is 65% below the norm. Finally, we will be making changes, and we're going to outline that for you in the upcoming slides, but our specialty prescriptions, they represent 54% of our total costs, but yet those specialty drugs only comprise 1.2% of the total prescriptions within the county. So these are some of the reasons that the data that we were looking at that made us realize we do need to make some changes so that we're able to continue to offer competitive health insurance. I should add, if you have questions throughout this presentation, please put it in the chat, and we're going to try to answer as many questions as we can throughout the presentation. If there are questions we aren't able to answer, we will be sending out a frequently asked questions document and making all of this information available to you on our website at the end of the month. So we're finishing our in-person presentations, and then we'll be putting this recording, this presentation, and frequently asked questions on our website, because we want to give you as much information as we can so that you're able to make the best decisions during open enrollment. So this slide just kind of shows you what the average Racine County spends per employee for our healthcare costs. So all the way on the left, you can see those are based on Racine County's 2021 health insurance claims. The next one over compares Racine County to other employers in the Midwest. The third column is showing employers that are similar in size, so other employers that have between 750 and 1,000 employees. And the last column is comparing Racine County to other state and local government employers. So you can just kind of see on the average, Racine County is spending more per employee on our healthcare costs.
Okay, so this next slide is going to share with you what our actual premium changes are going to be in 2024. So we wanted to break this down for you so you could see what you're paying right now in 2023, what it'll be in 2024, and what the difference will be. So that first table on the top, at the left, 2023, we're talking about single and family insurance. A little bit over to the right, that's a 2024 rates. So you're going from 52.05 to 61.43 for a single. That's a difference of $9.38. This is what the difference that you will see per paycheck. Again, for family, we have $150.30, which you're paying this year for family insurance. That's going up to $177.38 with a difference of $27.08. Again, that's per paycheck. If anybody has premium dental, these are what the changes are going to be at that second table below. So you were paying $12.50 for single, $15, and that's a difference of $2.50. Family was $44, it's moving up to $51, and that's a difference of $7 per family per check. Our vision insurance rates have not changed at all. So if you have vision, there's not going to be any change to your check. And our basic dental is going to remain at $0 for single and for family. This is a slide we wanted to share with you because you may not be aware of what your prescription cost looks like within our plan. If you have a prescription, it's going to be broken down into a certain tier. So we have tier 1 generic, tier 2 preferred brand, tier 3 non-preferred brand, and tier 4 specialty. If you look over to the right of that table, it tells you that for each tier, you're going to be paying 20% of the cost, but there's also a minimum amount and a maximum amount associated with each of those tiers. If you notice on tier 3 and tier 4, so tier 3 non-preferred brand has a minimum of 55 and a maximum of 100. Tier 4, which is our specialty drugs, that has the exact same minimum and maximum. So if you remember with one of the first slides, we spoke about how expensive our specialty drugs actually are. So based on that, we decided to make a few changes. The next slide will tell you what those changes are. So we're going to make a minor change to the tier 3 drugs. The maximum is increasing from $100 to $125. Tier 4, this is where the bigger change is going to be made. So instead of paying 20% of that drug, it's getting bumped up to 30% of that drug. However, we have partnered with CVS. They're our prescription benefit manager that kind of oversees all of our prescriptions. So we have a program with them called Prudent RX. And Prudent RX is a program that will reach out directly to any employee or retiree that has specialty drugs. And they are going to put them into this program as long as they have the permission. And they're going to look for every single coupon or rebate that they can find. So that employee hopefully is not going to end up paying the 30%. We've been told that they'll be paying a lot less than that. We did have a question that says, can you provide an example of a specialty drug? And then we had another question, is there a drug list showing what drugs are in what section? So Jessica, for your question, if you go into caremark.com, that's the website that you can go to and you can actually create an account there. You can manage all of your prescriptions that way. And there is a place where you can actually download an entire list of all of the prescriptions that are covered. And they are broken down based on those tiers. And there's like a legend on the top of it that says if they're in all caps, it means it's a generic. If it's an italic, it means it's a preferred brand. So you kind of have to read a little bit to figure it out. And if you have a prescription that you just can't figure out what it is, sorry, we just had a new member. Just reach out to me and I can ask CVS what that is. As far as specialty drugs go, we asked how do people know if they're in a specialty drug tier or not, and they said these people will know because they actually have to go through a separate pharmacy, and I believe they all have to be mail ordered, and there's a lot more hand holding when it comes to specialty drugs. So if you have a prescription and you're not sure if it's specialty, it most likely is not. But again, if you're not sure, you can reach out to me and we can try to figure it out.
And a lot of these drugs, the specialty drugs, require an injection or an infusion. But again, if you or your dependent is currently on a specialty drug, you would know that you're on a specialty drug. But we will make the list of drugs available. At the end of the month, we're adding a special section to our website, so you'd be able to check what tier your drug is on. And again, just to go back to that first slide, out of all the prescriptions, specialty drugs make up 1.2% of all the specialty or all the prescriptions Racine County employees and dependents are on.
And then also I did want to add that Prudent RX program, they will reach out to everyone. So if you're currently on a specialty medication, we've been told that you can expect to get some sort of notification from them in October-ish of this year, just saying, hey, you know, your plan is now partnering with Prudent RX, let's get you going. And then anyone that has a specialty drug after 2024, they'll just be reached out to at that time.
So again, we will be providing a link so that everybody can check to see what tier their prescriptions are currently on. All right, so we've kind of walked you through two of the big changes so far. So the premium increases and the changes to specialty drugs or prescription drugs. The next part is regarding emergency room visits. So this slide just lays out some data that we were able to come up with to demonstrate what our ER costs currently look like. So the pie chart on the left, you can see that when we took a look at all of our ER visits, the largest percentage of employees and dependents that are utilizing the ER are employees that are between the ages of 20 and 39. And the next largest chunk was the employees between the ages of 40 and 59. So this was kind of a surprising statistic for us when we looked at this data. And then when we compared ourselves to other employers, we noticed that our ER expenses are almost 100% above the norm. So this kind of helped us to make this decision that we do need to make some changes to try to control those costs. So for 2024, we will be adding an ER copay. So this is if anybody visits the ER and you're not admitted to the hospital, you will have to pay a $250 copay. This is not required for you to be seen. You will be billed later after your visit. So we don't want to, if you're having an emergency, we don't want to discourage you from going to the ER because you will be seen. You just would have to pay this ER copay later on. Unless, of course, you're admitted to the hospital, then the ER copay is waived. And we did reach out to a lot of other employers and found that most employers have an ER copay in place, and they put it in place years and years ago. So most employers couldn't even tell us how long ago they had it in place because it's been so long that they've had it. So what we learned is this is kind of a standard practice when it comes to health insurance. And then that last statistic is important too. So when people utilize the ER for a common condition, it costs 10 times more than when they're treated at an urgent care center. So we just got a question about the time frame for the ER increase. So that'll start in 2024 is when the ER copay will start. Another question, what happens if we go to prompt care or the walk-in and they decide we need to be seen at the ER and won't let us be seen in prompt or urgent care? So unless you're admitted to the hospital, you will have to pay the ER copay. The only time the ER copay is waived is when you're admitted to the hospital. So even if you're referred by an urgent care or a prompt care, that copay will need to be paid unless you're admitted to the hospital. So this is something positive that we're doing with our health plan. As we've been doing our research, we've learned that more and more employers are adding fertility benefits to their health plan to recruitment and retention. So starting in 2024, we will be adding fertility solutions to Racine County's health plan. So this is a program that is set up through United Healthcare, and employees and dependents, I should say employees and spouses that want to utilize it will reach out to United Healthcare, and they'll be hooked up with Fertility Solutions, and Fertility Solutions will help make sure that employees and dependent spouses are making the best possible decisions for their course of treatment. And we will be covering up to $30,000 lifetime benefit per employee or spouse towards Fertility Solutions. So Fertility Solutions does help navigate all of the different options and providers through this process, and they'll be trying to help employees utilize what they call their centers of excellence to get the best possible outcomes. So if you or someone you know who's on our health insurance is interested in Fertility Solutions, they can look for more information coming up in 2024 or reach out to Human Resources.
Okay, so now for the last big change that we're going to be adding to our plan. We've got a high deductible health plan or an HDHP plan that we are now going to include. So you have the option of sticking with the traditional plan or moving over to the high deductible plan. So a high deductible health plan is a health plan that has a higher deductible than a traditional plan, and everything, including prescriptions, applies towards your deductible, except for preventative care. So just remember that if it's a preventative care checkup, that's always going to be free for you. If you are on the high deductible health plan, you will have less coming out of your paycheck each month for insurance premiums. However, you will have to incur more medical expenses out of your pocket. So in other words, your premiums are going to be a lot lower. Your deductibles are going to be a lot higher. So once you've reached your deductible, then you have also met your max out of pocket. And at that time, the plan will pay 100% of all charges as long as they are in network. Again, preventative care and wellness exams are always going to be covered for you at no cost. And one of the benefits of having a high deductible plan, besides the fact that your premiums are going to be lower, is that you can utilize our new HSA. So this is a very simplified version of the plan, and this is all assuming that you're going in network. So the single premium is going to be $42.98, and the family premium is $120. So these amounts are about 30% lower than what we have with the traditional plan. But as you can see, the deductibles are a lot higher. So for a single individual in network, the deductible is $5,000. For a family deductible, it's $10,000. A little lower, you can see that the max out of pocket is exactly the same as the deductible. And we wanted to do this just to make things very simple so that you know when you met your deductible, you've also met your max out of pocket, and then therefore the insurance will pay 100% of all of your charges after that, again, as long as you're going in network. And then another reminder that your preventative visits and exams are always covered 100%. So were there some questions here?
There's a question about the current deductibles for the regular plan, and are those changing?
The current deductibles for the regular plan are not changing. It's $1,000 for an individual, $2,000 for a family. And will we be able to check the costs of the specialty meds before open enrollment to decide how these are going to affect our costs? Again, there is a tool when you go on caremark.com, and like Sarah said, we can put that link on our website as well, where you can see, it's like I can't remember what they call it, but you can see what your possible costs would be if you had that particular drug, knowing that you're on the plan that you're on. So I do think that there's a tool on there. And again, this is kind of new to us too. So if you go on caremark.com and you've searched around and you can't find anything, then just let me know and I can reach out to our representative to see if we can get you some more specific answers. And then the other question is the $250 ER copay applied to the high deductible plan as well. It is applied to your max out of pocket for both plans.
Yep, so the ER copay will apply to anybody who's on our traditional plan. And if you decide to opt into the optional high deductible health plan, the ER copay also will be applied.
Okay, so as I mentioned before, one of the other perks for the high deductible plan is that you have the ability to be in the health savings account or the HSA. So this is also new. We partnered with Educators Credit Union to provide this benefit. And it's basically what an HSA is, an account that you will set up with Educators Credit Union where you can contribute tax-free dollars that may be used for qualified medical, dental, and vision expenses. And you may only enroll in this HSA if you have the high deductible health plan. One of the things that Racine County would like to offer is that if you do enroll in the high deductible health plan and you do enroll in the HSA, that we will automatically contribute $500 for a single plan and $800 for a family plan. Something to keep in mind, if you have an FSA account, you are not able to do an HSA account at the same time. So if you currently have an FSA account and you're considering moving over to a high deductible plan in the HSA, make sure that you spend down all of your dollars in the FSA before the end of the year, because if you had a rollover, you wouldn't be able to utilize that money because you would have opened an HSA. And then the other thing too is, like an FSA, obviously these are pre-tax dollars that you can use for medical expenses, but unlike an FSA, this money belongs to you. So it's yours forever, whether you leave the county, stay with the county, retire, it always belongs to you.
And then we just got a question about why the HSA account is only offered with the high deductible plan. So the IRS has a lot of regulations and rules when it comes to health insurance and FSAs and HSAs. That's just one of the rules that's in place. You can only do an HSA if you have a high deductible plan. So we have been getting questions about having an HSA, and this was the only way that we were able to offer an HSA to our employees, is if they elect to have the high deductible plan. So again, we don't take any of these decisions lightly. We really want to make sure that we are trying to help you control your healthcare expenses. So these are just some tips on how you can control your healthcare expenses. And then we're going to kind of remind you of some other benefits that Racine County currently offers that you can utilize, and most of them are free of charge. So if you don't currently have a primary care physician set up, please establish a primary care provider. This way you are forming that relationship with a provider that gets to know you and your history, and they're able to provide you that. The next bullet point is the preventative care. Remember, preventative care is always free, so make sure you're getting your annual screenings and seeing your primary care physician every year. That way, if there is a health concern, ideally you can catch it early on. Remember virtual care options. So this slide says that it's for episodic care and it averages $49 or less. Ani and I just learned about that United Healthcare has been rolling out more and more virtual care options. So just recently, they actually started offering virtual care, primary care, so that not only can you talk to a doctor about an episodic condition like an ear infection or pink eye or something of that nature, but you can actually speak to a primary care doctor virtually about an ongoing condition or a condition that you're currently trying to manage. They've also added some specialty virtual care. So they have a dermatology specialty, migraine specialty, and some behavioral health specialty doctors that you can see virtually. And I know for myself, I've used the virtual care through United Healthcare, and it really was a seamless process. My son had pink eye, and I was able to see a doctor through my phone within 15 minutes. And he was able to set up a prescription. So it was a lower cost to myself, less time being away from work and less time my son being away from school. And it saved us a lot of money too. It was really convenient. So just don't forget that that is an option and that United Healthcare keeps expanding this option. If you don't currently have a myuhc.com account, I encourage you to set one up. That's going to help you to make some of these healthcare decisions that you're going to want to make for 2024. You'll be able to look at what your healthcare costs look like this year and the prior year to help get an idea of what those expenses look like, to find out which plan would be the best plan for you. But that's also where you can access some of these virtual care options. And UHC also has an app that you can download on your phone. That's what I utilized when I used the Teladoc for my son's condition. And it's really intuitive, really easy to use. And I just encourage everybody to take advantage of those tools that United Healthcare has. Another way you can try to control your healthcare expenses is start an HSA or an FSA, so that you're using tax-free dollars to cover your medical expenses. And then please remember that we do offer the Employee Health and Wellness Clinic, and that's for employees that have our health insurance. So that there were some tough times, I'm going to say, with the clinic going through the pandemic and right after that, where they were experiencing some staffing challenges, but they really have improved the services that they provide. And you can also make appointments online, scheduling online. So if you need to be seen same day or next day, one of the best ways to do that is schedule an appointment online early in the morning, so that that's when they are releasing the appointments they have available. All right, and we have a question. So as of April of this year, UHC renegotiated their contract with Ascension. My office visits are now 3 times the amount they were in February this year. Will be going up more in 2024 then. I'm not aware of any increases with UHC and Ascension. I know that, I know that they had kind of made a tiered system at UHC, and that Ascension, starting in 2023, Ascension was no longer a tier 1 provider. So I think that's a part of why you saw that price difference, but we have not been made aware of any other changes regarding Ascension.
Yeah, and just with that too, like Sarah said, we don't know of any changes that are coming, and I do understand, if you've got your doctor that you're set with and you don't want to change, totally understandable. But one way to help avoid that is if you do go to myuhc.com, like Sarah mentioned, that's another great tool that you can use, because you can see what the preferred providers are. So they're going to be the providers that have the lower cost, that are rated a little bit higher.
So here are some current benefits. We just want to remind you and make you aware, if you're not aware, that they do exist. So 2 years ago, we did add a more robust EAP program, and that is eligible for all employees and dependents. And the best part about our EAP is that it does offer 6 free visits per person per incident per year. So what that means is if you were having, let's say, marital issues and you reached out through our EAP, you would be eligible for 6 free visits to help discuss those marital issues. Then later on in the year, you're experiencing some depression or anxiety. You would then be, that's considered a different incident. So you would then be eligible for, again, 6 free visits for that incident. So if you haven't checked out, so our EAP provider is FEI, and FEI does so much more than just those behavioral health visits. So if you haven't already checked out their website, please do. They offer financial assistance, legal assistance, and kind of help with some different resources with work-life balance as well. And again, that's all free to you, our employees, and your dependents. Last year, the county added this other benefit called Second MD. And Second MD is a program to help assist employees that have been newly diagnosed with a condition, or maybe they've been recommended to have a surgery. And what it does, and it's no cost to our employees or dependents, but you would reach out to Second MD, and a nurse would be in touch with you to ask you some basic questions and also get your permission to share your medical information with a leading expert in whatever ailment you have. So let's say that you were recently diagnosed with breast cancer. You would be matched with an expert in the nation who their expertise is breast cancer. And they would review all of your medical information and either confirm that, yes, they agree that you're on the right course of treatment, or they might have a different recommendation. And then Second MD will actually help navigate those conversations with your provider, because that could be a little awkward for you to say, well, I just spoke to somebody at Mayo Clinic and they disagree. They think I should not do this surgery. So they'll help navigate those conversations and communicate with your doctor as well about what the recommendations are. Is the reviewing physician identified for 2nd.MD?
Identified, like, will you know who the,
I think
Yeah,
that's what
yeah.
you're asking.
yes, they will, yes. The reviewing, you'll have a virtual appointment with that physician, so you'll actually speak with that physician.
So again, Real Appeal is a program that we put in place a couple of years ago. And this is a weight loss wellness program through United Healthcare. So this is something that anyone can sign up for, but if your BMI is over a certain percent, then you get access to some additional tools and resources. And you get this, what they call the Success Kit, delivered to your door. So that includes a scale for your food and measuring tape and recipes, and you get to join a group with people just like yourselves that are trying to be on this weight loss health journey. So the first year that we rolled this out, our Racine County employees had some really good luck, and Racine County employees lost a total of 300 pounds through the Real Appeal program.
Yep, and that was all within the first year. And I don't know if Sarah mentioned, but there's you can also meet with a coach as well. So it's a pretty cool benefit that's free for you if you want to get a little healthier and lose a little weight. There was another question. I know we have family max out of pocket, but are RX for the tier 4 drugs applied to the deductible, or are they completely separate and have no max? No, they are still applied to the deductible. Okay, and then just another quick reminder about the FSA that we have. Each year you can enroll in the county's FSA program. This must be done during open enrollment. The 2024 limit, so you always have a limit on how much you can contribute each year. So our new limit for next year is going to be $3,200. You can use an FSA for your medical expenses. You can also use the FSA for your dependent care, also elder care expenses as well. So again, if you wish to enroll in the HDHP for 2024 or the high deductible health plan and be eligible for the HSA, you must spend down those FSA dollars from 2023. And then last but not least, just a reminder about the clinic. Sarah already said a bunch about the clinic, but we really want you guys to utilize it. It's a way to save money for everybody. We will be having a new health coach, which I'm really excited about, through the clinic, and they are not only going to be able to meet with you one-on-one, so you'll have free health coach visits, which I think is really, really amazing, because who gets a free health coach visit? So you can meet with her one-on-one, but she's also going to try to become an expert on the Racine County's plan, the city's plan, and RUSD's plan, so that when you go in and you say you're from Racine County, she's going to know all of these benefits that we're talking about today and what you are eligible for. And so she can talk with you about those as well. Again, this is just another list. You can use the clinic for sprains, strains, cold and flu, UTIs, well child visits, sick child visits, sports physicals, women visits, labs, all of that. Can you switch the slide? And then the one thing that I want you guys to take away, though, is if you are going to do the high deductible health plan, you can still use our clinic. But there will be a copay when you go in. So there's going to be a $25 copay when you utilize the clinic. And again, this is all IRS rules. So legally you have to pay what they consider to be fair market value if you're on a high deductible plan. So everybody will have to pay the $25 copay when they go visit the clinic if you're on the high deductible plan. Most of the prescriptions will continue to be free for you. There may be a few that we might have to charge either a separate copay for or just send you off to a regular pharmacy for, but we're still working out those kinks with CVS and with our clinic. So there'll be more to come with that.
So we've got some questions coming in. So the Real Appeal program is through United Healthcare, if you're interested.
And they do send out emails to you. So if you get a Real Appeal email, it's coming directly from United Healthcare because they know that you're a member. So you can respond to that email. If you want specific contact information, we'll have it on our website, but you can also reach out to me and I can send you a flyer.
And then somebody was asking where they can direct feedback outside of this meeting right here. You can reach out to myself, Sarah Street, or Ani Lefebvre if you have some additional feedback that you'd like to provide. What date does the FSA account need to be spent down by?
You would ideally, so the FSA is a little tricky because you can technically utilize your money. You have like a 3-month grace period. So by the end of March, you could utilize that money, but could only be for any of your expenses that you had in 2023. So that would basically be if you wanted some reimbursement for something, you would have 3 months to do it. But ideally, I would just say, just to be on the safe side, try to spend it down just by the end of the year.
And that's only if you're doing the high deductible plan, correct?
If you want to do oh yes, I'm sorry, I just assumed that's what you meant. If you want to do the HSA, that's when you have to spend it down by. But if you don't want to do the HSA, then again, what I said, still true. You have that 3-month grace period to get reimbursed for anything in the previous year. But if you have a rollover amount, we're allowing $550 each year for a rollover. That rollover you can utilize for the entire next year.
And then somebody's asking about our employee usage rate that the county sees with our EAP services. I don't have a usage rate right in front of me, but I can tell you that our providers and experts that we work with are really happy with our usage of our EAP. We get a gold star for how our employees are utilizing the EAP, and comparatively, Racine County uses the EAP a lot more than other employees that we're compared with. Another question about the HSA, so we can only have an HSA with the high deductible plan. Yes, that's correct. The only way you can enroll in a health savings account is if you're in a high deductible plan. So that's one of the best benefits about enrolling in a high deductible plan, is that then you do have access to an HSA.
Okay, and then finally, just wanted to take this moment to remind everybody that open enrollment is just around the corner. So every single year we have an open enrollment from November 1st through November 15th. If anyone did open enrollment last year, you will remember that we went through the employee self-service portal, and we're going to do that again this year. We'll be sending out reminders, and we'll be sending out like cheat sheets on how you can go into ESS to do that. Another reminder, again, if you do want the FSA, you have to enroll every single year during open enrollment. And then just to make everyone aware and to remind you that our vision benefits last year were taken out of the medical. So if you wanted vision benefits, you went in during open enrollment last year and you signed up. If anybody missed that information and you never signed up for vision last year, that means you do not have vision benefits this year. So if you want them, then you'll want to utilize the open enrollment to sign up for that.
And another question is, and it's related to the HSA, so there are no other savings options. So there is another savings option, and that is the FSA that Ani was just saying you have to re-enroll in every year. And so the FSA is to be used for your health reimbursements, medical reimbursements, and you can also use it for dependent care reimbursement.
It's very similar in that you're using pre-tax dollars. So this is another way for you to save money. The difference is that you have to be careful about the amount that you choose to put into that account, because by the end of the year, you will lose that money unless you just, we do have, like I mentioned before, we have that rollover. So if it's below 550, you'll get to roll it over. If it's above it, then you'll lose that money. So it's just another way to do, it's almost identical to HSA. You just have to be a little more careful with it.
We got another question. If you're able to participate in the premium dental without being enrolled in the medical, and you can. So you could elect, you might be getting your health insurance somewhere else, but you would like to participate in the county's premium dental plan through Delta Dental, and you can absolutely do that. And the time to do that would be during open enrollment. So we can give you guys a couple more minutes to add any questions that you have in the chat. But just a reminder, we will be sharing this presentation and the recording of today's meeting, and it'll be put on our website at the end of this month. So we still have 3 more in-person meetings that we're doing with employees. We'll be at Dominic Drive this afternoon, and Next week, we'll be at the courthouse and at Ives Grove for in-person meetings. You're happy to attend one of those meetings as well. And once all those meetings are completed, we'll be putting this presentation, this recording, and any other information we have, including the CareMark link and more information about a high deductible plan on our new and improved website. So we've been working really hard at improving our website, and we'll be rolling that out to all of you at the end of this month. So there'll be an email coming out letting you know that the new website is live and all the benefit information for 2024 is on the website.
We got a question saying, same question for vision. Yes, you can enroll in the vision insurance without enrolling in the medical. And then, will the county be offering the flu shots for the upcoming flu season? We will, and I actually just reached out to the clinic about this because it's a little late already. They said to give them a little time, so I think we might have some answers for you guys within a week or two. Hopefully we'll have some dates set up, but we definitely are going to offer the flu clinics again. Hopefully in October. And then, yep, I did answer that question about the vision. So yes, you can enroll in the vision without having to enroll in the medical.
And any other questions, please feel free to put them in the chat.
Okay. If you think of any questions moving forward, you can feel free to reach out to me. But again, at the end of the month, we're really excited to roll out our new employee website for the Human Resources Department. So make sure to look out for that email that says that the website is live at the end of the month with all of this information that we talked about.
We want to make sure that we're giving you all the information that we can so that you can make an informed decision for you and your family for 2024.
Yeah, that's a good point. Make sure to go home and share all of this with your spouses so that, everyone has a say in this.
All right, if we don't have any more questions, we really thank you for your attendance today. And please feel free to attend one of the remaining 3 in-person meetings, and then watch out at the end of the month for this presentation to be on our new employee website.
Bye, everyone.
Bye, thank you.